Hello everyone, welcome to the ITLS Academy. Today's topic is on the lecture Nutrition Intervention with Population. In our previous lecture, we have discussed about nutrition intervention with a particular individual. Now, today we'll be taking the whole population. So, beginning with our lecture, first is the National Food and Nutritional Policy. So the major cause of mortality and morbidity nowadays are generally the cardiovascular diseases and type 2 diabetes and cancer, and all have a strong nutritional etiology. So both uh, public policy and direct contact with the patient presents the opportunity to reduce the risk factor associated with the major non-communicable diseases, that is the poor diet, physical inactivity, smoking and obesity. So there are strategies for preventing these diseases are developed at the national and local levels. The first is the question arises, who informs the national food and national nutrition policies about the causes and about the data, what are the diseases the public are being suffering. So the first policy, the first we can say agency is the Food Standard Agency, that is the FSA. So FSA is a government agency. It works independently of the government as it does not report to a specific minister. The FSA, that is the Food Standard Agency, has main role in helping the people to eat more healthily. They promote simple informative labeling to consumers. They works on to reduce foodborne illness by improving food safety throughout the food chain, and they promote best practice within the food industry, and also they improve the enforcement of the food law. The next is your body, the Scientific Advisory Committee on Nutrition, the SACN. So in the past, let me tell you, in the past from 1963, the government relied on the expert advice on nutrition from COMA, that is the Committee on Medical Aspect of Food and Nutrition Policy, which produces a series of reports that were used for information of nutritional policy. But since when the Food Standard Agency body was formed in 2000, when it was established, the government has replaced the COMA with SACN, which provides the independent expertise to the government primarily through the Food Standard Agency and the DH. It includes advising on the generally provides the advisement on the nutrient content of the food, the definition of a balanced diet and nutritional status. They also tell about the nutritional problems that impact on vital public health policy, where the nutrition is one of the several risk factors in, for example, many diseases, for example, the obesity, cancer, cardiovascular diseases, and osteoporosis. They also works on the nutrition of vulnerable groups, for example, infant, older people, and their disadvantaged groups, and nutritional monitoring and surveillance, and also works on research needs arising from these areas. So these all are the informatory bodies, these all are the national policies which works on the nutrition in the in contribution for the health of public and local public individuals, or the person who are suffering from somehow any of the disease. In our previous lecture, I am telling about these bodies, and today these bodies are responsible for providing any policies related to the health issues. The third is your Department of Health, that is the DH. So one section of the DH is involved in public health. For example, choosing the health white paper had a public consultation period before being published by the DH in 2004. So DH generally works on different policies. They deliver different policies in many years. So some of the policies such as choosing healthy delivery plan for delivering choosing healthy health, making healthier choice easy. That was published in 2005. The interface between the DH and the FSA is sometimes unclear, though, for example, both have recently produced infant winning leaflets. Other section of the DH coordinates with the National Service Framework, that is the NSFS, and the National Institute of Health and Clinical Excellence, that is the NICE, provides the guidance for diabetes children and young people and maternity service, and the forthcoming NICE guidance is on the obesity prevention management. So these are the bodies, these are the policies which are generally made in terms in regard for the uh, duration for the health of a public. So the question arises, how is nutritional status is monitored? First, firstly, the first survey is your household consumption survey. So in household consumption survey it is an example of a national food survey which comes under the DH. As I told, the National Food Survey was established in 1940s to monitor the diet of urban working class population during the war years. And the main target of this is to collect the data on the food expenditure and their consumption. The next step is your individual dietary survey. The National Diet and Nutritional Survey, the NDNS program, comprises the diet survey for different age groups, and it also incorporating the measurements of your weight and height to gather information about the dietary habits and nutritional status. Along with this, the NDNS is produced on behalf of the Food Standard Agency and the Department of DH, as I told, and the survey is generally conducted for the population, which are it includes the population such as children aged between 1.5 years to four and a half years. It includes the population of young people aged between 4 to 18 years, and some adult people 19 to 64, lie between 19 to 64 age, and people those who are aged above 65 years. Now the third step is your health survey. So in health survey, it comprises a series of annual survey that was started since 1991. In this, the dietary data are qualitative and based on frequency and type of foods consumed with the food record or questionnaire. Weight and height is usually measured, and additionally waist and hip circumference is also added in the recent years of survey. Last is your food supply data to ensure adequacy to national food supplies. The main aim of this survey is to monitor the progress towards the public health nutrition target, and also it aims to detect the nutrition insufficiency. It identifies the nutrient access and also the access the level of intake or additives contaminants. Now let's talk about the local foods and nutritional policies. So local food policy are generally available that focuses main on first is your food health and nutrition, and this according to this the local food policy which works on food health and nutrition, the aim is to improve the diet of local citizens by providing consistent appropriate nutrition messages and addressing the potential barriers to achieve a healthier diet. It also works on food and mental health. In this, it develops the awareness of the emotional and psychological dimensions of the food, growing and consumption. It works on organic production, that is to stimulate expansion of the production and consumption of local organic food. Fourth one is your GMOs, that is genetically modified foods, to raise awareness about the different perspectives that exist regarding genetically modified organisms. Fifth is food safety, that is to reduce the number of cases of food and waterborne diseases. Sixth one is your waste and composting. The target is to reduce the amount of waste associated with the production, consumption, and disposal of the food that is sent to the landfills or incineration. Seventh is your work that local food policy works on animal welfare also, to promote the high standard of animal welfare. It works on inequality and food access, is to address issue of social exclusion and ensure people on a low income have access to healthy affordable food. It works on local food production, that is to increase the local consumption of locally produced food. Your global perspective is to raise the awareness of the effect of the world trade system on the small farmers in the developing world. And lastly, local food policy also works on production and biodiversity in order to encourage methods of the food production that protects and enhance the biodiversity. So these all are the work that is performed by the local food and nutrition policy. Their aim is to target these also points rather than only targeting a say particular population. They have to look into the matter in the whole world and what are the problems that comes across through environment or through uh, nature or through the particular behavior of a person. Okay, the next is the need for local food and nutrition policy. Okay, why there is a requirement for this? It is used to provide a political mandate and support for implementation. It is used to make available a scientifically accurate document of what constitutes a healthy diet to a wide audience. It is used to encourage consistent dietary message by health professionals and other agencies who have a role in nutrition education. It is done to recommend an action plan for implementing the policy in key settings. It also ensures by collaboration with other local agencies and employers that it is easier for citizens to eat a healthy, sustainable diet. It is used to a population-wide approach to try and shift the distribution of risk factors for diet-related non-communicable diseases. It is needed to develop strategies that makes healthier behavior the social norms, therefore lowering the risk in the whole population. Local food policy is also needed to provide nutritional advice for certain groups within the population who have a specific nutrition need, for example some hospital patients, children and older people. It is also required to facilitate a wider choice of food in establishment within and outside the NHS so that a healthier diet can be selected. So these all are the points that says why there is a requirement, why there is a need for any of the local or nutritional policies. The next is steps in conducting nutrition interventions to promote health. So in order in this, the first step is defining the problem. Whenever you have to conduct any nutritional intervention, there are certain steps. You do not start interventions at any time. There is a step. Firstly, the defining the problem, where the needs assessment of nutritional priorities are set up scale of the problem using epidemiological and socio-demographic informations should be available there and should be understood properly. There is a requirement of analyze possible modifiable determinants, for example, environmental, behavior, economic, and social. Identify the main partners from the planning stage, assess the community needs, perceive priorities, and define measurable short and long term nutrition health goal. So, this all are the work that is done under the first step, that is the defining the problem. Now comes to the next step, that second step starts with the generating solution. Okay, in generating solution, what we have to do, we have to aim for intersectorial working with the range of stakeholder, use tacit knowledge, means know how from practitioner to inform interventions, reviews and refers to explicit the knowledge source, that is the research and evidence based guidelines to build a theoretical principle. And in this the solution for the preparation of solution, we have to use participatory appraisal method with a local community to develop a sustainable solution. Okay, now when we gather the information of for generating the solution, then we go for the third step, that is your building capacity. Now, in this, we have to develop a institutional framework in which we have to act and identify the support and structure, and also we have to determine and mobilize the amount of resources needed. For example, from where we get the funding and the key actor materials, what are the requirements are we have to required in our future steps. Training and infrastructure development we have to do. We have to also keep in mind to raise the public and political awareness and define the management and operational roles of different partners. Now when this is decided, then comes your fourth step, that is implementing and in implementing the interventions. In this, the elaborate an action plan, strategies and activities we have to discuss in this. Firstly, verify that there are a range of complementary interventions working on, such as education, social mobilization. For example, education, you can take the media educating patients, social education can be provided. Social mobilizing, for example, community development, or you can go for mass communication to influence social and environmental economic factors that influence healthy, and also go for advocacy, for example, lobbying for political organization and structural changes. And along with this, we have to monitor using process measures to help ensuring quality in practice, allowing the feedback on implementation, participant and practitioner response. Then the last stage comes your evaluating if the program meets its objective. When you have this defined the problem, you have generated the solution, you have then build up the things, and then finally you have implemented all your strategies you have planned out. Then comes your the final step of evaluation. Health promotion outcomes include the health literacy, for example, knowledge, attitude, belief, self efficacy, social actions, which includes the community participation, social norms, and public opinion, and health public organization policy. So these are the things that comes under the evaluation procedure. Intermediate health outcome includes your healthy behavior, your healthy environment, effective health service, and health and social outcomes, long-term goals, which decreases the morbidity of for a group of people. For example, decrease in obesity, cardiovascular diseases, and increase quality of life and equity. When you grasp these things, means you see the result in decreasing obesity, and that will comes your that is your final step of evaluation. Now, next is there are some examples of nutrition policy in different settings. First model is your you can take the model of a local infant feeding policy for under 5. In this, the nutrition that is provided, the policies that is provided who are under fives at a day, nursery, playgroup, and child minders can apply on that. So in this, the nutrition policy for less than 5 years, training health professional and nursery staff are required for this, advising on you can give advisement on meals or nurseries and nutrition guidance for the nurseries. The generally the main groups that are involved in this is the health visitor, the GPs, the midwives, dietitian, day nurse staff can be work on this. And the target is to increase the number of key workers receiving training, increase the knowledge of workers related to nutrition, and also increase the quality of meals at a day nurseries. You can give the nutritional policies in local school food policy, where the composition of working party could be your nutrition and dietetic service, community and hospitals, sorry, not community and hospitals. It includes your school premises, the school staff, and some of your groups of children, the teachers, the governors, the pupils, and people, school nurse, dietitian, health promotion officers. These are the partners in this model, and the strategies that should be followed, the action that should be taken is uh, you can provide fruits in tuck shops, and healthy food awards should be is one of the strategic plan for getting this nutritional, implementing a local food and nutrition policy in school. And you go for a school nutrition action group or school nurse support and training, production of nutrition resources, cooking skill clubs can be these are the small schemes that can be introduced in school in for the benefit of implementing a local food policy for the prevention of nutrition related chronic diseases. And the indicator for success of this plan is where you get the result with an increase in nutritional quality of school meals using audits, or increased number of secondary school with healthy food scheme. There is a higher number of schools with nutritional policies and higher uptake of healthy choices as a at breakfast clubs. There is also some of the policies option for preventing the obesity. Now it is being introduced. So it is widely recognized that preventing obesity requires more than a health or medical perspective. It needs to be viewed for a wider social and economic context that involves the partnership working on a population wide basis on as obesity touches all the society. So the participation generally involves the structural environmental changes will require the participation of a range of key stakeholders. For example, the governmental approach. For example, departments of health, nutrition, food, agriculture, transport, education. So these also works for this policy. Food production system, health system, media, education system, workplace, local communities also are the partners for this policy for uh, getting rid of the obesity. Next is the definition in health promotion. So, health promotion is almost always concerned with the change and has been defined by the WHO as a process enabling people to exert control over and improve their health, whilst recognizing that shaping of a health environment contributes to improving health status. So, health is a positive concept that emphasizes social and personal resource as well as the physical capacities. And therefore, health promotion is not just the responsibility of the health sector, but it goes beyond the healthy behavior of well being. So, in this promotion, the first international conference on health promotion was held at Ottawa in Canada in 1986. That was the first health promotion conference that was held there, that produces what is now widely known as Ottawa Charter for Health Promotion. And then according to that, they, that counseling, three basic strategies for health promotion were decided. First was advocacy, that is for health, to create the essential condition for health, the enabling for all people to achieve their full health potential, and third is mediating between the different interests in society in the pursuit of health. So these strategies are supported by five priority action areas that was governed by the Ottawa Charter. First is the build a healthy public policy, to create supportive environment for health, to strengthen the community action for health, to develop personal skill, and to reorient the health service. So in this regard, the comprehensive approaches to the health development are most effective. Those that use combination of above these five strategies are more effective than single track approaches. It defines your five priorities, that is to promote social responsibility for health, to increase investment for health development, to expand partnership of health promotion, to increase community capacity and empower the individual, and also to secure an infrastructure for health promotion. Now let's see what is the health education. After when the this uh, Ottawa Charter has been concerned, it was the first conference. Then the topic of health education was started. So health education is not only concerned with the communication of information, but also with fostering the motivation, skill, and self-efficacy necessary to take action to improve your health. So health education includes the communication of information concerning the underlying social, economic, and environmental condition impacting on health, as well as individual risk factor and risk behavior, and the use of healthcare system. So health education may involve the communication of information and development of a skill that demonstrate the political feasibility and organizational possibilities of various forms of action to address social, economic, and environmental determinants of the health. In general, this approach is divided into qualitative and quantitative methods for evaluation in health education. Using multiple methods in health promotion evaluation improves the power of evaluation and validity of the conclusions. So a distinction is often made between qualitative and quantitative approaches evaluation. The quantitative research examines the pattern of behavior and attitude by assessing how certain factors influence the expression of these patterns. Particularly, it is useful to estimate net effect of the program. For example, whether dietary changes can be attributed to the interventions. And second one is qualitative method. Qualitative method attempt to determine the meaning and experience of the program for those involved and to interpret the effects that may have been observed. So in this particularly it is useful for measuring the process. Thank you for being with us. For more information related to this, you can log on to our website www.itlsacademy.com and register yourself. You can also follow us on Instagram, Facebook, WhatsApp, Twitter, LinkedIn. And yes, do not forget to subscribe our channel ITLS Academy at YouTube. Thank you.